So today we'll learn more about type 2 diabetes. Before that, I would like to introduce to you our speaker for the day, and who is Dr. Vinoth Chellaiyan. He's a diabetologist and physician with over 12 years of experience in diabetes, and he's also a faculty at the Chettinad Hospital, Chennai. He has also published around 75 papers, medical journal papers, and he also is researching more on the secondary prevention of diabetes. So good evening, Dr. Vinoth, and welcome to the webinar.
Good evening.
And I am the moderator here. My name is Dr. Preeti Sharma, and I head the consumer content vertical at Phablecare. So we'll start the session, Dr. Vinoth. So as we are all aware that around 643 million people are projected to be diabetics by 2030. Now, in India, if we say, we have around projections saying that it will be greater than 40 million people by 2020 will be diabetic. So Dr. Vinoth, I would like to understand, and our users also would like to understand exactly what is diabetes and what are its types and how does it affect your health?
Yeah, good evening to all the participants. I would like to start the lecture with thanking the organizers for organizing a wonderful webinar. So let me start with what is diabetes. Diabetes is basically a metabolic disease which is characterized by hyperglycemia. This hyperglycemia means there is an increase in blood sugar levels. This hyperglycemia occurs because of a defect in either insulin secretion or defect in insulin action. So insulin is basically a hormone which is secreted by a gland in our body called pancreas. So whenever there is a problem with the secretion as well as in action of insulin, this diabetes sets in. So coming to the types of diabetes, basically there are three types of diabetes. One is type 1, type 2, and gestational diabetes mellitus. So in type 1, the insulin secretion is very minimal, or in some cases there is no insulin secretion at all. Usually occurs in age group less than 20 years of age, whereas in type 2 there is insulin secretion, but there is a problem with its action, either due to the resistance of the insulin or there is inadequate in insulin action to target organs. Whereas the type 3, which is gestational diabetes mellitus, which is occurring in pregnant women during the course of their gestation, and it may also progress after the delivery of the baby. So we are much focused on type 2 diabetes mellitus in this webinar. So coming to the last part of our question, how does it affect our health? It's basically a lifestyle disorder which affects the metabolism of carbohydrates and to a certain extent fat and protein metabolism as well.
Sure, Dr. Vinoth. Also, I would like to know, and our viewers would like to know, कि type 2 diabetes को हम adult onset diabetes कहते हैं. Now, but nowadays also हम देख रहे हैं कि बहुत सारा increase हो रहा है number of cases. So I want to understand exactly what can be the reason for this increase, and also कौन-कौन से लोग होते हैं जो at risk हैं इसके लिए.
अच्छा, ये बहुत important सवाल है आपने raise किया है. आजकल we see lot of young patients, especially those who are less than 30 years of age, they develop diabetes. The main reason for this is lifestyle behavior. So as I told you just now, it's a lifestyle based disorder. So any lifestyle related practices, lifestyle related behaviors usually causes diabetes at younger age. So lifestyle क्या होता है? Lifestyle में we have dietary habits and physical activity. So dietary habits means we have unhealthy dietary habits such as fast food, junk food, and all these fried items. All this will come under dietary habit, poor dietary habit. Lack of physical activity and also sedentary lifestyle that we are usually majority will follow. Those who go to regularly go to office type of jobs, they follow a sedentary lifestyle. So these two factors are culprits in terms of setting in diabetes at a younger age. So in addition to this, there are certain other factors which I would like to point here. One is obesity, which is also called as overweight. So overweight is an important predisposing factor for diabetes. And one more important factor is family history of diabetes. Suppose parent with the diabetes, father or mother with diabetes, their children have higher chance of developing diabetes if they don't have a healthy lifestyle. So both the parents are diabetes, having diabetes, the children are pretty high chances of getting diabetes if they don't follow any lifestyle modification or healthy lifestyle pattern.
Yes, absolutely, Dr. Vinoth. Lifestyle changes, actually lifestyle habits, I would say, definitely plays a very important role. But to understand it more deeper, I would just like to understand, and all the viewers here would like to understand also, how common is type 2 diabetes? And I shouldn't be asking this question, but yes, how serious is it? Now we can't measure the seriousness, but if you can throw light on that, how serious is type 2 diabetes and how common it is?
As you have mentioned in the introduction part of this webinar, the data says around 7.7 crore population person in India are affected with this deadly disease, and it is expected to rise to 9.2 crores in the year 2020. And if you say in simple terms, every seventh person or sixth person you find in India is having diabetes, and this excludes the pre-diabetic state, which is the state before diabetes, which is also contributing to 50% of the burden to the community. And you, as everybody knows this, India is said to be the diabetes capital of the world. So the burden is really high, and it's actually a worrisome issue. So answering to your second part of the question, is it a serious condition? Yes. If we don't have a good control of diabetes, like a good control of blood sugar levels, definitely it can lead to a lot of complications. So in simple words, I can say diabetes is not a killer disease, but uncontrolled diabetes is.
Absolutely true, Dr. Vinod. It is the most important disease, I would say, as when you take a part of chronic disease, chronic diseases, chronic lifestyle diseases. Now here also, when we are in this webinar, a lot of people may be diabetics or their loved ones are diabetics, and they are inquisitive to know more exactly how can we live better with this condition. So in view of that, if you could throw some light on what are the symptoms and the signs of a type 2 diabetes, person who has type 2 diabetes. So what are the common symptoms and signs that we all encounter and we can encounter?
Yes. So I have told you already that like there is a condition called pre-diabetes. It's a phase just before the diabetes and the diabetes. Both have common symptoms to be reported to. So the most common symptoms is excessive thirst, increased frequency of urination, increased appetite. They feel like eating more and more. In spite of that, also they lose a lot of weight. And the most important part is most of the patients, they come to us with a complaint of fatigability, that is the tiredness. They don't feel like energetic, they feel low energy throughout the day, and even in the morning also they don't get up with full of energy. So these are the most common symptoms of type 2 diabetes. There are non-specific symptoms as well, such as the dimness of vision and foot ulcers, and even some of the patients, they present with kidney disease also in type 2 patients. So we need to be very vigilant while addressing the symptoms of any common patients who come to us. We have to rule out diabetes for such patients.
Yes, Dr. Vinod, when you're saying that increased thirst, so we always say in medical condition, and doctors always say to patients, if I'm not wrong, that yeah, it's polyuria, polydipsia, polyphagia. These are the medical terminologies normally used for these symptoms. Now, suppose if I say, yes, finally, if a diabetic has these symptoms, so the diabetes person will say, fine, if I have this, I can control it by lifestyle or something. But why is it important to diagnose type 2 diabetes at an early stage? What is the reason behind it?
Okay. So as I told you earlier, World Health Organization recommends to screen everybody who are above more than 30 years of age. Annually, they should be screened for type 2 diabetes because as early as you detect the disease, you can avoid a lot of complications. In simple words, I can say आप जितना जल्दी आप डायबिटीज है आपका मतलब वो पता कर सकें, उतना जल्दी आप उतना तेज से आप सारे कॉम्प्लिकेशन को अवॉइड कर सकते हैं. जैसा मान लो आप कॉम्प्लिकेशन के नाम से हम बोल सकते हैं हार्ट अटैक, स्ट्रोक हो गया, और किडनी डिजीज, डायबिटिक किडनी डिजीज और आई डिजीज, ये सब कुछ मतलब हम अवॉइड कर सकते हैं if you find out the diabetic status little earlier, in early stages of the disease.
Thank you, Dr. Vinod, for a deep insight in that. Now, हमको पता है कि डायबिटीज एक क्रॉनिक कंडीशन है, एंड ये हर इंसान को डायबिटीज, जो अलग अलग लोगों को डायबिटीज है, उनकी जर्नी अलग अलग होती है, वो किस स्टेज पे होते हैं, क्या होते हैं। सो क्या दिमाग में रखना चाहिए उनको कि अगर हम टाइप 2 डायबिटीज से डायग्नोस हुए तो कोई पॉइंटर्स हैं कि हमको दिमाग में रखना चाहिए कि यस ये फैक्टर है कि हमें दिमाग में रख के कि हम ये सब ऐसे होना चाहिए?
ये बहुत अच्छा सवाल है। आई वुड लाइक टू रिस्पॉन्ड इन 3 सिंपल वेज। लाइक आपको 3 चीज याद रखनी है। पहला चीज कॉम्प्लायंस ऑफ, एज सुन एज इफ आफ्टर यू हैव बीन डायग्नोस्ड विद डायबिटीज, तो आपको 3 चीज याद रखनी है। पहला वाला तो डाइट एंड फिजिकल एक्टिविटी विच यू शुड बी वेरी वेरी केयरफुल। एंड दूसरा चीज है कंप्लेंट्स ऑफ ड्रग। कभी भी आप दवाइयाँ बंद नहीं करनी है अपनी तरफ से, तो अनलेस एंड अनटिल विदाउट कंसल्टेशन विद द डॉक्टर। एंड थर्ड वन इज स्क्रीनिंग फॉर कॉम्प्लिकेशन। जो भी मतलब फ्यूचर आने वाला कॉम्प्लिकेशन ड्यू टू डायबिटीज, आपको हर साल में एनुअल स्क्रीनिंग होती है, so that your treating physician will be helping to you in finding out the complication or finding out the complication at earlier stage.
Now, suppose once you are diagnosed with type 2 diabetes, the challenge here is to how do we manage our blood sugar level? हम कैसे manage करें and manage करके हम उसके साथ कैसे जिए, and living happily with it. Now, let's understand, for all our viewers here, let's understand what are some of the factors that can affect the lives of a person who's a diabetic on a daily basis, and how can they be controlled or modified here. So, Dr. Vinoth, आपसे ये सब चीजें जान के it's pretty enlightening here. So I would like to also know about it. How is blood sugar monitored, and how frequently should one monitor the blood sugar level and keep a record of their measurement?
Okay, so once you are diagnosed with diabetes by a trained physician, initially for titrating the dose of the drug or to bring the sugar levels to a desired level, so we need to measure more frequently. Suppose a patient is started on insulin, so to bring the sugar levels to control, the frequency of monitoring of blood sugar is very frequently, like very frequently. That is like every weekly we are supposed to monitor. Once the sugar levels are like brought to the desired state, then we have to do the sugar levels once in every 3 months. Suppose if the patient is started on oral tablets, so initially we are supposed to monitor on monthly basis. After once the sugar is being controlled, we are supposed to monitor on every 6 months. That depends upon the type of patients and type of the drug or medication they take.
Yes, absolutely, because it depends on different patient, as different patients have different journeys during their course of treatment. Now, कौन सा आइडियल ब्लड शुगर लेवल्स होता है जब हम कहते हैं कि आपकी डायबिटीज कंट्रोल में है, एंड व्हाट लेवल्स आर कंसिडर्ड एज अ रेड फ्लैग? मतलब इट इज लाइक कि इसके बाद तो आपको देयर इज समथिंग रॉन्ग विद यू. सो
to find, first of all I would like to tell you what are the blood tests we usually take to diagnose type 2 diabetes mental. 3 ब्लड टेस्ट हमको मतलब लेना होगा. तो पहला वाला फास्टिंग ब्लड शुगर कहा जाता है, तो विच इज लाइक यूजुअली डन इन द फास्टिंग स्टेट. खाली पेट में सुबह सुबह आपको एक ब्लड टेस्ट खून की जांच देनी होगी, तो उससे हमको फास्टिंग ब्लड शुगर लेवल्स पता चलेगा. और दूसरा पोस्टप्रॉन्डियल की 2 घंटे के बाद, खाना खाने के बाद, आफ्टर ब्रेकफास्ट यू आर सपोज टू टेक दैट ब्लड टेस्ट. आफ्टर दैट HbA1c. तीसरा है HbA1c. ये आपको बताता है पिछला 3 महीने का आपका ग्लूकोज कंट्रोल कितना है, मतलब कितना अच्छा आप कंट्रोल कर रखे हैं आपके शरीर में. तो वो मेजरमेंट ये HbA1c कहते हैं. तो बेस्ड ऑन दीज 3 पैरामीटर्स वी यूजुअली डायग्नोस टाइप 2 डायबिटीज मेल्टस. सो नाउ कमिंग टू द कट ऑफ लेवल, कितना कट ऑफ आपको बिलो रखना चाहिए इफ यू आर डायग्नोस्ड विद टाइप 2 डायबिटीज मेल्टस. So fasting should be less than 126 and postprandial should be less than 200 and HbA1c should be less than 6.5. So these are the cutoffs we are supposed to maintain to have a good control of diabetes in the long run. So anything above this are definitely a red flag sign, and we need to report to the doctor immediately for dose alteration or addition of new drugs.
Thanks so much for the insight. I want to understand also, suppose if we say out of these 3 parameters what you had told us, now suppose a patient has high HbA1c levels and the remaining 2 are indecisive, so will that be a red flag?
Yes, Yes, definitely. If any of these three parameters, any of the three parameters, if it is abnormal, we need to be very careful in monitoring and subsequently, and that is why the frequency of monitoring comes into play. We need to check again after 1 week or after 1 month after the starting of drugs or after advocating any lifestyle modification. We need to be very careful to bring all the three parameters under the control, under the cutoff which I've told you, right?
Thank you so much, Dr. Vinoth. Now, when a person, you must be aware, you'll have a lot of patients coming to your clinic, and we normally the doctors use, your blood sugars are fluctuating. They
Yes.
use this statement. Now, patients, or their relatives, they get confused. What is blood sugar fluctuation? So if you can throw some light, what is blood sugar fluctuation and what causes them, and how can we control that?
Yes. So blood sugar fluctuation is one of the challenging thing we usually encounter in our practice to bring the blood sugars under normal range. So what happens once you start the drug, we advocate the patient, we advise them lifestyle changes. Once after 3 months, the patient comes to us with uncontrolled blood pressure, blood sugar levels, and we find out that there is a fluctuation in sugar levels. There are three basic reasons for this. One is either they miss the diet, or they delay the diet, or they miss the medication. These are the most three commons where there is a blood sugar fluctuation, provided the dosage of the drug or drugs are fine. Because that sometimes what we do in our daily life, we may forget to take tablets, or we may forget to take the food on right time. अगर ब्रेकफास्ट हम नाश्ता हम 10 बजे को करते हैं, पिछले रात हमने डिनर 9 बजे किया होता, तो मतलब देयर इज अ लॉन्ग आवर्स ऑफ फास्टिंग. तो इतना लंबा आप मतलब फास्टिंग नहीं रखना है, क्योंकि our body metabolism is like already determined. So when on top of it, like diabetes, there is a chances of both hypoglycemia and hyperglycemia. Hypo means low blood sugar level. Hyper means high blood sugar level. So we need to take into consideration of these factors, and once you follow a regular diet on time पे आपको खाना खानी चाहिए, और you should not skip any tablets on your own. As I told you previously, you should not stop the drug at all, like without the consultation from the doctor. So these are the two parameters you should keep in mind to avoid sugar fluctuation in your body.
Now we were talking about hypoglycemia and hyperglycemia. So I'm just deviating from a topic here. So just wanted to understand कि what exactly for our users, उनको समझने के लिए कि hypoglycemia होता कब है और कैसे, और अगर immediately हम उसको prevent कर सके, बाद में तो we have to go to the doctor and we have to go to diabetologist, आपके पास आना पड़ेगा, और then you will prescribe certain medication and lifestyle changes. But what exactly can we do immediately to counteract hypoglycemia or hyperglycemia also?
Before prescribing any drugs to a diabetic patient, हर पेशेंट्स को ये जानना जरूरी है हाइपोग्लाइसीमिया क्या होता है. हाइपोग्लाइसीमिया मैंने बताया, ब्लड में शुगर लेवल्स बहुत कम हो जाता है. कभी कभी ये ग्लूकोज की ड्रग की वजह से भी हो सकता है, कभी कभी लॉन्ग आवर्स ऑफ फास्टिंग, खाली पेट आप ज़्यादा घंटे आप कुछ भी खाए नहीं, उसकी वजह से भी हो सकता है. तो ये दो चीज़ों से के कारण आपका हाइपोग्लाइसीमिया हो सकता है. आपको मतलब कैसा पता चलेगा हाइपोग्लाइसीमिया हो रहा है मेरे शरीर में? तो आपको मतलब ज़्यादा पसीना आना शुरू हो जाएगा, आपका मतलब दिल पैल्पिटेशन जैसा, दिल धड़कन जैसा, मतलब ज़्यादा आपका अनकंफर्टेबल महसूस होगा, आपका अनकंफर्टेबल फील होगा. तो आपको तुरंत आपको मतलब एक मन में ये आइडिया होना कि मतलब ये हाइपोग्लाइसीमिया हो सकता है तुरंत. इसलिए आप अपने घर पे you have to keep a glucometer, which is a small device which can be used for measuring capillary blood glucose. उससे आप मेजर कर सकते हैं मतलब आपका ब्लड शुगर कितना है. अगर आपका ब्लड शुगर लेस देन 60, लेस देन 50, लेस देन 70 हो गया, तो आप तुरंत आप दो चम्मच शुगर को पानी में मिला के तुरंत पीना होगा, ताकि आपका ब्लड शुगर लेवल नॉर्मल हो जाए. So this is very, very important. Hypoglycemia is very, very dangerous than hyperglycemia. So you should be very careful about this hypoglycemia, and you should be very, very cautious in taking the diet and the drugs as well.
Absolutely right. Now, अभी हम लोग ने बात करी है डॉक्टर विनोद कि about sugar management and कि कैसे हमने उसके symptoms, complication type 2. अभी अगर आपसे बात हो रही थी तो आपने हमसे कहा था कि lifestyle changes play a very important role in management of type 2 diabetes. So I would like to understand that and how does it happen? आपने आपको हमको बताया कि आप अपने टाइम से खाना खाइए, अपनी दवाइयां टाइम से लीजिए, और कोई फैक्टर्स हैं जो we have to take in consideration when we say lifestyle management? कुछ और हमको दिमाग में रखना चाहिए?
नहीं, ये दोनों चीज को फॉलो करना ये बड़ी मुश्किल काम है, क्योंकि इट्स मोर इजियर सेड देन बीइंग डन। लाइक आप एक्चुअली यू हैव टू पुट आवरसेल्व्स इन द शूज ऑफ अ डायबिटिक पेशेंट। उनका बहुत मतलब अपनी तरफ से बहुत सवाल हो सकता है, डाइट में ये खाऊं ना खाऊं, इसको मतलब कितना खाऊं, क्वांटिटी में कितना खाऊं, कम खाऊं ज़्यादा खाऊं, और फिजिकल एक्टिविटी में कितना करूं, मतलब क्या क्या टाइप ऑफ फिजिकल एक्टिविटीज में मुझे करना होगा। ये सारे डिटेल्स हमको मतलब इन डिटेल जानना बहुत जरूरी है। मतलब दैट इटसेल्फ इज गोइंग टू मेक अ बिग इम्पैक्ट इन द कंट्रोल ऑफ डायबिटीज। यूजुअली आई यूज्ड टू से टू माय पेशेंट्स 50% हो गया ये डाइट और फिजिकल एक्टिविटी का, बाकी 50% आपका ड्रग मैनेजमेंट। तो इतना इंपॉर्टेंस इक्वली वी हैव टू गिव टू द पेशेंट इर्रेस्पेक्टिव ऑफ व्हाट लेवल व्हाट स्टेज द पेशेंट इज इन। अगर मतलब उनका प्री डायबिटिक स्टेट में हो, नहीं तो कुछ लोग मतलब इंसुलिन के डिपेंड हो, मतलब जो भी पेशेंट्स हैं whatever the stage they are in, the both should go hand in hand. Diet and physical activity in one hand, another hand taking of right drugs at right time.
राइट। सो अगर आप डाइट की बात करें डॉक्टर विनोद, तो अगर हम पूछे कि हाउ डज डाइट इम्पैक्ट डायबिटीज, और हर डायबिटिक का एक सपना ही होता है कि द मिनट द पर्सन सीज कुछ मिठाई तो दिमाग में आता है कि मैं खा लूं कि नहीं खाऊं, मैं ये खाना खाऊं कि मैं ये वो वाला खाना खाऊं। मतलब द पर्सन इज नॉट हैप्पी टू जस्ट क्लोज द आईज एंड से ओके आज पूड़ी आलू बना है तो पूड़ी आलू खा लेते हैं। So we would like to understand actually कि डाइट इम्पैक्ट कैसे करता है डायबिटीज, और क्या क्या डायबिटिक्स को खाना चाहिए और कौन से फूड हमको अवॉइड करने चाहिए।
ये बहुत अच्छा क्वेश्चन है। इट्स वेरी वेरी एसेंशियल क्वेश्चन एज वेल। सो डायबिटिक नाम सुन के आपको मतलब बहुत सारा क्वेश्चंस मन में आ जाता होगा कि मतलब ये आपने जैसे बोला आलू खाऊं कि ना खाऊं, मतलब आज तो आलू खाना पड़ेगा, मतलब आलू बहुत अच्छा लगता है, आई लाइक आलू potato very that's a part of my regular diet. So I would like to tell you, you can consume whole grains. First of all, I'll tell you like what are the things you can consume. Whole grains, millets जैसा बाजरा and jowar, और fiber rich food, green leafy vegetables, sprouts और कसूरी मेथी, ये सब मतलब आप ज़्यादा खा सकते हैं। There are certain things which you have to completely avoid, completely बंद करना चाहिए, जैसा refined sugar हो गया, स्वीट्स हो गया, कभी कभी वंस इन अ जैसा मतलब दिवाली के टाइम में, कभी मतलब छुट्टियां के टाइम में, तो फेस्टिवल के टाइम में आप ले सकते हैं, दैट आर टू इन अ मॉडरेट क्वांटिटी, दैट्स नॉट लाइक लिमिटेड क्वांटिटी, दैट्स इन अ लिमिटेड क्वांटिटी, नॉट इन अ लाइक लार्ज अमाउंट। सो यू हैव टू हैव ए सेल्फ कंट्रोल। रिफाइंड शुगर आप बिल्कुल नहीं खाना है। और रूट्स में ट्यूबर्स में खाता है, पोटैटो, क्या बीटरूट, याम, कोलागेशी, ऑल दिस थिंग्स यू हैव टू कम्प्लीटली अवॉइड। एंड वाइट ब्रेड, पास्ता, मैदा, पिज्जा, बर्गर एंड फ्रेंच फ्राइज, ये सब कुछ आपको बिल्कुल ना खाना चाहिए। उसकी जगह पे आप मतलब होल ग्रेन्स खा सकते हैं, जैसा मतलब ब्राउन राइस खा सकते हैं, बीट खा सकते हैं, ये सब कुछ मतलब रागी खा सकते हैं। और फ्रूट्स में देर इज लॉट ऑफ कंफ्यूजन अमंग द पेशेंट्स आल्सो, क्या क्या फ्रूट मैं खा सकता हूँ। तो मतलब फ्रूट में आप खा सकते हैं, गोवा खा सकते हैं, एप्पल खा सकते हैं, ऑरेंज, मस्कमेलन एंड इवन वाटरमेलन, तरबूज भी मॉडरेट क्वांटिटी में खा सकते हैं। तो डाइट में हम मतलब एक अलग से वेबिनार भी बना सकते हैं, मतलब इतना बड़ा सब्जेक्ट है। तो आई स्टॉप विद दिस लाइक वन मोर इम्पोर्टेंट कॉन्सेप्ट कि हर कोई भी आप डाइट आइटम, कोई भी फूड आइटम आप लेंगे, आपके मन में एक टर्म मैं आपको मतलब बताना चाहूँगा, वही ग्लाइसेमिक इंडेक्स। हर फूड आइटम का एक ग्लाइसेमिक इंडेक्स होता है। व्हाट इज ग्लाइसेमिक इंडेक्स? ग्लाइसेमिक इंडेक्स इज द एबिलिटी ऑफ द फूड आइटम टू इंक्रीज योर ब्लड शुगर एज सून एज यू कंज्यूम। जितना जल्दी आपकी ब्लड शुगर को बढ़ाने के लिए वो क्वालिटी होता है, उसको ग्लाइसेमिक इंडेक्स कहा जाता है। तो there are three classifications, those who are having those food items which are having low glycemic index, moderate high glycemic index and high glycemic index. We are supposed to take those food items which have low glycemic index. ये चीज आपको मतलब मन में रखना चाहिए। Whatever food item you have to think, is it a low glycemic index food or high glycemic index? So accordingly you have to choose your food item. That's it. And diabetic, one more final thing I would like to tell is diabetic plate. डायबिटिक प्लेट का मतलब ये है 50% आपका प्लेट में ग्रीन लीफी वेजिटेबल, तो रिमेनिंग 25% शुड बी प्रोटीन, जैसे दाल, पनीर और लीन मीट, एग्स होगा, और बाकी 25% wheat or rice. So this is the pattern of diabetic diet. So diabetic plate. So if you follow this dietary modification, dietary pattern, definitely you can live for longer. You can lead a life like a normal person.
Thank you, Dr. Vinoth. Actually, to be very frank, मुझे भी नहीं पता था ये सब, and a lot of insights I've got. Thank you so much. अब आपको पता भी होगा कि कि आर इंडियंस, हम लोग अपने को इंडियंस जो बोलते हैं, हम लोग कहते हैं कि हम इंडियन हैं, और हमारा तो फेमस चीज है कि हम एक्सरसाइज से दूर भागते हैं mostly. Now it's changing. Now people are going to gym and they are very conscious about their body weight. But usually अगर आप देखते हैं, आपको क्लिनिक पे आपके भी आए होंगे पेशेंट, तो यूजली जो डायबिटिक्स होते हैं उनको एक्सरसाइज करना अच्छा नहीं लगता. So we all need to understand also कि can regular physical activity help in managing your blood sugar levels, in turn diabetes, and what are the types of exercise that you need to do to keep your weight in check and hence diabetes?
Yeah, it's very important, crucial question. I would start with the weight. So as I told you in the initial part of our webinar, so obesity is an important factor, which is a risk factor for insulin resistance, which is a risk factor for development of complication of diabetes. So we need to, what is obesity? Obesity is the excess weight. So how it is measured? It is measured based on the BMI criteria. BMI criteria हमारा Asian Indians में कितना होनी चाहिए? It's a normal is like 18.5 to 22.9. Anything between these two range is very normal. Beyond that, 23 to 25 it is called overweight. 25 above 25 it is called obesity. So you have to keep your weight in control. How will you achieve that? You will achieve using the diet and also physical activity. Physical activity बहुत important है. आपको कितना टाइम दिन में कितना टाइम करना चाहिए? ये वाला क्वेश्चन के लिए आई वुड टेक द रेफरेंस ऑफ वर्ल्ड हेल्थ ऑर्गेनाइजेशन का रिकमेंडेशन है, तो 150 मिनट्स का फिजिकल एक्टिविटी इन ए वीक, दैट ट्रांसलेट्स टू 30 मिनट्स पर डे. अगर आपके शरीर के लिए आप 30 मिनट भी यूज नहीं कर सकते, मतलब स्पेंड नहीं कर सकते, तो आपको मतलब जस्टिफिकेशन नहीं होगा ना. तो यू हैव टू स्पेंड एटलीस्ट 30 मिनट्स फिजिकल एक्टिविटी डेली, which is to be very moderate and brisk exercise. That is about the time, that is the time or quantity of exercise. Now what are the types of exercise which you are supposed to do? I will tell you in a very simplified manner. Safe exercise, I will tell you using a mnemonic which is called SAFE. S comes with strengthening exercise, which is like resistant based exercise. जैसा आप जिम में जाके आप मतलब वेट लिफ्ट करोगे, कोई रेसिस्टेंस वाला एक्सरसाइज करेगी, so that is like strengthening exercise. Next comes the aerobic exercise, that is SA, aerobic exercise, that it works with a major bigger muscles, so that is aerobic exercise. Next is the flexibility, flexibility exercise, which is stretching, yoga, all these are flexibility exercise. And finally is the endurance exercise, the low intensity repeated exercise or endurance exercise. So these are the types of exercise SAFE. In simple terms, इतना डिटेल भी नहीं जाना चाहूँगा, मतलब सिंपल टर्म्स में बताऊंगा. जैसा वॉकिंग हो गया, आपका जॉगिंग हो गया, साइकिलिंग, स्विमिंग, जो भी मतलब आपको महसूस होना है, मतलब आपने कुछ मेहनत की है, मतलब because a lot of people ask me like daily I walk leisurely for 30 minutes. So that is not that is good only, but that is not adequate. So you should do a moderate intense exercise. आपको पसीना आना चाहिए, जैसा मतलब this holds good for all the patients except the patients who have cardiac issues. Cardiac जिनका मतलब कोई already heart का problem है, उनका अलग protocol है, but apart from that, this is the normal protocol which we recommend to the patient.
Thank you, Dr. Vinoth. अच्छा, अभी हम लोग जो रह रहे हैं आजकल के टाइम्स में, स्पेशली ड्यूरिंग दिस पैंडेमिक, वी आर वर्किंग फ्रॉम होम एंड देयर इज लॉट ऑफ स्ट्रेस. पीपल आर वर्किंग फ्रॉम होम, दे आर वर्किंग more than they work at office, and stress plays a very, very important role. If I'm a diabetic and again I'm under stress, so I just want to know, will it impact my blood sugar levels? And if so, then how can we reduce this stress?
Definitely, it's a very important question because of our life schedule has become more stressful and very busy. We keep on like going behind the work and work. So finally, we end up getting a lot of stress. So stress is very, very dangerous in controlling diabetes mellitus. So stress produces a lot of chemicals in our body, noradrenaline, adrenaline, cortisol. All these chemical mediators, chemicals which are being produced in the body, are counteractive to insulin. So all these hormones which are released during stress, they suppress the action of insulin, thereby increasing the blood sugar level. So how do we come about it? Like we have to have a proper meditation, yoga, and mind relaxation exercise then and there. So these are the various ways to cope up with your regular stress, and that is why we need to enroll ourselves in a program like where that is a comprehensive program, just like that Phablecare is having a 360 care program in which they cover all these aspects like dietitian and consultation with the doctor and health coach who looks into exercise pattern and also um, and all kinds of parameters lifestyle changes. मतलब सब कुछ उसमें आ जाता है मतलब this is one of the good program which I have ever seen like in recent days. That is a comprehensive program. It's like we have to enroll ourselves to that program so that it will be like will be like our burden will be lessened. So we'll be under a guided thing, we'll be under a monitoring so that we'll not to worry about this रोज मुझे ये करना है वो करना है. So at least like if we have a guided protocol, if we follow that, and that is very important in maintaining our blood sugars into control.
Yes, absolutely, Dr. Vinoth. At Fable, we say it's manageable. So, and plus with all the information you have provided, yes, absolutely. We have so many doctors, life coaches who work with all the diabetics throughout their journey, holding their hands and telling them that you are not alone. We are there with you. So, okay, coming back here, when we say that we need adequate amount of sleep, everyone wants to sleep. Nowadays, everyone wants, they find some time, they say, let's sleep. So does sleep play any important role in type 2 diabetes? If adequate sleep or, less sleep, does it affect type 2 diabetes? Also, when I'm talking about sleep, I'll talk about some vices which everyone has, like smoking, alcohol. So how do these factors affect type 2 diabetes?
Yes. So I would like to answer the first part of the question first, which is like about the sleep. So normally, leave the diabetic people. For a normal person also, you should have a good sleep of 6 to 8 hours every day. Especially when a diabetic person का picture आ जाता है, so we have to advocate them for a regular sleep of 6 to 8 hours per day. Anything lesser than 6 or anything above 8 hours is also like worrisome. So because during the sleep, our circadian rhythm, which is the rhythm that our body's biological clock, so that actually everything is normal and calms down our body, and all the hormones, all the ecosystem of our body like functions normally if we have a good sound sleep. So if the sleep is disturbed, definitely that is going to affect your blood sugar levels as well. Researchers have been done on this sleep, which is called chronobiology, and there is a direct link between the sleep, disturbed sleep of anybody like who's sleeping less than 6 hours per day. They are prone to develop a lot of morbidities and future complications if they have diabetes. Those who have adequate sleep, the complications development is very less, and they are able to live life like a normal person. And the second part of your question, like smoking and alcohol. Smoking not only increase the risk of cancer, it also increase the risk of heart attack by increasing the deposits of cholesterol in the blood vessels, and it alters the metabolism also, thereby increasing the blood sugar levels. And alcohol also, it's directly affects the metabolism of food items, the carbohydrate metabolism, and also it increases the risk of development of complications, and we find it very difficult to keep the blood sugar levels in control in those patients who are alcoholic. So I would say like no to both conditions, like both smoking and alcohol is a big no. If at all, if you want to consume alcohol, that you can prefer to take red wine in a small or moderate quantity. That is once in a while. not regular.
Understood, Dr. Vinoth. Yes, actually, there should be no smoking, no alcohol. But yeah, it takes time for any person who is an alcoholic to cut down on alcohol. But yeah, smoking, I think that's an absolute no. So now, when we have discussed about the symptoms, the signs, the sugar levels, and we have discussed about diet, let's come on to the complication. Okay, what exactly, first of all, are there any complication to type 2 diabetes? And if so, what are the complications? If you can explain to in details to our viewers, that would be great.
Okay. So coming to the complications of diabetes, we usually classify the complications into macrovascular and microvascular. Macrovascular complications are heart attacks and stroke and other peripheral vascular diseases. And microvascular complications usually affect the smaller blood vessels. Say, for example, diabetic kidney disease, we call it as diabetic nephropathy, where the minor smaller blood vessels are affected with glucose levels, and diabetic retinopathy, there's a problem with the eye retina, and diabetic foot, which is like diabetic neuropathy. As a result of diabetic neuropathy, will get diabetic foot. So these are the complications in simpler terms, I would say. Like these are the complications.
Yes, I understand that. Yes, we are dividing into it, and they are serious complication of type 2 diabetes if you don't take your diabetes seriously. You might land up having either of them. Now, at times, usually you must be aware also, and you must have seen patients, Dr. Vinoth, that diabetics have usually delayed wound healing. Suppose they get hurt in their foot or they get hurt in their hands. Normally, we'll heal around 7 days, 6 to 7 days, everything disappears. But in case of a diabetic, the wound keeps on, progressing. It doesn't heal. It takes a lot of time. So what is your take on that? How do they handle this, and, how can they make their life little better?
Yes, yes. So as I mentioned in our previous discussion that diabetic neuropathy can lead to foot ulcer. Especially the foot is more prone for trauma. Trauma means like any injury. If they don't take any precautions. So how to avoid the foot ulcers and thereby subsequently delayed wound healing problem, all the infections. So is by wearing properly fit shoes or chappals, and washing and cleaning the foot regularly, and trimming the nails, and avoid walking barefoot. So an annual foot examination is an important role. So the diabetologist or the doctor treating physician would check your foot regularly and check the nerve function of the foot in an annual basis. So if you follow all this point which I told you, you can avoid diabetic foot ulcer, thereby avoid delayed wound healing, and subsequently we can avoid amputation or cutting of it.
Yes, Dr. Vinoth, thank you so much. Actually, now these tips and tricks would have, made our viewers more vigilant about type 2 diabetes and how do we manage them. And the nice way you have put about the diet and what should we do and the complication. So, but still now there are more questions to come here that we need to understand also, how does infectious disease like COVID-19, for example, when we say that we are in the pandemic state right now, and we can say that, yeah, now it's 2 years and we are going through it, and God willingly it should end soon. We need to understand exactly about, do diabetics require additional care during COVID-19? For example, if a diabetic is, if COVID-19 and diabetes, how do they coexist? For example, this question, if I have to ask you. So if you can throw some light, does COVID-19, make diabetics' life difficult? Or is it the same complications and the symptoms and signs which a normal diabetic without a COVID-19 would experience?
Okay. So I would like to answer this question in two parts. The first part is like the risk. The risk for a type 2 diabetes person in getting the COVID infection is similar to that of a normal general population who don't have the diabetes. So the risk is same for both the persons. So the second part is like once COVID-19 sits in, the patient with type 2 diabetes mellitus gets COVID-19. So there comes the important role. So already we know that like diabetes is an immunocompromised state. That is like the immunity of the body is low in diabetes mellitus. So on top of it, like this added infection, COVID-19 infection would be more dangerous in managing the COVID-19 as well as managing the blood sugar sugar levels during the phase of illness in the hospital. So we use a steroid form. So what will you do? Like steroid itself is like immunosuppressive drug. So already immunocompromised state, which is diabetic, we are adding steroid. So that itself is actually, because we cannot refrain, we cannot stop using steroid in a patient with COVID-19 infection. So we have to give steroid. So that way it also increases the blood sugar levels, and further there is a complications of further infections such as black fungus and mucormycosis. So all the other secondary bacterial infections, they are at high risk. So the best thing is to take precautions in preventing COVID-19 by vaccination or any other precautions like maintaining social distancing and wearing masks and all the other precautions suggested by our government.
Thank you, Dr. Vinoth. Yes, you were talking about vaccination. So, a lot of apprehensions were there. A lot of my relatives who are diabetic, they asked, जाना चाहिए कि नहीं, वैक्सीन लगाना चाहिए कि नहीं, वैक्सीन के बाद क्या हो जाएगा मुझे. So, मतलब मेरे जो साइड इफेक्ट्स होंगे, नॉर्मल लोगों की तरह साइड इफेक्ट्स हैं कि कुछ और हैं. So these are the questions everyone has in mind, still because right now the booster dose has come in. So again, there are the same questions creep up in the mind and say कि booster dose लगाएं कि नहीं लगाएं, 2 डोज तो हो गया, अब तीसरे डोज में मैं डायबिटिक हूं. So can you throw some light on this?
Yes, this is a very important question. Again, so I would relate the answer to the previous answer which I have given. So the second part of the previous answer that I told you, like the complication during the hospital stay, such duration, the severity can be brought down by the vaccination. So vaccination, if you have 2 doses, definitely it's good. And you need to take the booster dose as well, like that is the third dose as well. उसमें कोई मतलब second बिल्कुल नहीं, you have to take, because that definitely reduces the complication severity once if you get COVID-19 in future also. So it's very important that you should get 2 doses of vaccine, booster dose as well.
Also, right now we are entering into summers. And most of in South, yes, we have entered. In North also, summers have, come in already. So do diabetics, type 2 diabetics need additional care during summers?
Yes, in simple terms, the hydration is very, very important when summer is concerned. That is for normal person also, especially for diabetes. We need to keep ourselves hydrated. Minimum of 3 liters of water every day is very, very mandatory. And second part is like electrolyte imbalance may occur if we don't take a proper hydration, because some of the electrolytes are also like lost in sweat. So we need to balance that also. The first thing is to hydrate ourselves. Second thing is to balance our electrolytes by consuming oranges, muskmelon, tarboos, whatever, like the seasonal fruits which we usually. But in diabetes, we need to take everything in moderation. You can consume more amount of water. There is no restriction on that. But when it comes to fruits such as like watermelon, we have to take in moderation. So hydration is the key factor here.
Right. Thank you so much. And now, suppose if I'm a diabetic, my age is suppose 35. So, and there's another diabetic whose age is around 65. So are there any different ways of management? Do they differ in both the ages? And if so, how is it? And suppose also, if there's a pregnant woman, managing diabetes is different there, which I could understand. It's gestational diabetes when we call it, can be gestational, or it can be diabetes in a pregnant woman. So is the management different across all age groups, or is it the same?
Actually, there is a minor difference between the age group, as you said. The difference comes once in terms of medications that we usually prescribe. So the basic principle of lifestyle modification can be done by who's 35 years of age also, and those who are 60 years of age also. And even with pregnant women also, that maximum up to tolerable level, they can do minor moderate exercise during the pregnancy. So the basic concept remains the same. But like when it comes to the drug, medication, that is like tablet or like insulin, that differs between the patient to patient. Usually we cannot it's not like one size fits all kind of thing. So we need to we need to find out the blood sugar levels and all the other parameters into our mind before prescribing drugs. So from the patient side, So अपनी तरफ से we have to think in terms of lifestyle changes, dietary habits, and as well as physical activities, and taking drugs without skipping any medication. These are the three important things. To put in a nutshell, I would tell you like mantra. I would like to tell you like ABCD mantra hai. So A stands for HbA1c control. We have to keep our HbA1c to control, and B it's blood pressure control, and C is cholesterol control, and D is a disciplined life by practicing lifestyle, good healthy lifestyle. So this ABCD mantra will make you to live longer, just like a normal person. So this mantra holds good for any person, irrespective of the age or irrespective of their comorbid conditions.
Wow, Dr. Vinoth. Yes, nice. I will always remember the ABCD mantra. Okay, now when, most of our near loved ones and dear ones, they are affected by diabetes, be it our parents or be it our relatives, and there's always a caregiver associated with them.
Yes.
So I would like to understand that, do you think there is any advice that should be given to a caregiver of who's taking care of a type 2 diabetic?
Yes, definitely a person. It's not a single person who can fight with the diabetes. It's the family who should definitely support the person, diabetic person. जितने भी यहाँ पे मुझे शामिल हुए हैं मतलब family members. I want to tell you one thing, that like you have to support the person who is with the diabetes, because without your support it's very difficult for any person to keep motivated self. So here we can take help of a customized plan, such as like the Phablecare is giving Care 360, which is a guided platform, so that like if at all like everybody is feeling kind of demotivated, or like it's difficult, बहुत मुश्किल हो रहा है, मतलब रोज मुझे एक्सरसाइज करना पड़ रहा है, मुझे मतलब ये डाइट बनाना है, ये डाइट फॉलो करना है. So that then you can discuss with the person like who's preparing the diet chart, like who is the dietitian and the life coach. They can like sort it out, and ultimate goal is to live healthy. So to achieve that, like we can enroll in such programs, and Fable 360 is one of the finest and good programs I have ever seen in recent times. So like you can take help of such programs and customer plans as well.
Thank you so much, Dr. Vinoth. Actually, you have answered most of the questions. But here, the thing is, a lot of people are still asking questions on our Q&A. So I would like to, if you would allow, then we can just take some of the questions here.
Yeah, definitely.
Yes, so Rohit has been asking a question that gud, हम जो गुड़ खाते हैं ना, jaggery, is it a good replacement for a sugar or a tea?
Yeah, actually बहुत सारे patients मुझे ये सवाल पूछते हैं, like you can definitely like I need to answer this question. I was like, I would love to answer this question. So good is basically a fructose or sucrose based ingredient, so which actually getting converted into glucose in our body by enzymes. So ultimately, the end product of a good is glucose one. So there is a myth that like good is health. Good is health in terms of iron content when compared to refined sugar, but in terms of diabetes, it's a big no. We should not take good in replacement of refined sugar. But on the contrary, you can take artificial sugars like such as like sugar-free ho gaya, stevia. So that can be taken in tea, or like if you even you want to prepare sweet, that can be made from that artificial sweeteners.
Okay, that's nice. That's nice to know. Now, we have been hearing a lot of things about, different people saying diabetes can be reversed. So Srinath has been asking a question that, can diabetes be reversed? So I think you are the right apt person to answer this. So can diabetes be reversed?
Yes, and that is also a very very viral question, I would say, like that is prevailing among the diabetic community and also the family members of diabetes. So if I would like to answer this question, I would say yes, the reversal of diabetes is possible, but not for all the people. I would explain this like, see, if a person who is in a pre-diabetic state, definitely it is possible with the lifestyle modification and with minimal drugs, or even like without drugs also it's possible. Lifestyle modification alone will be enough. So those who are with advanced stage and who have other comorbidities such as hypertension and other problems, the reversal of diabetic may be temporary, but like ultimately if you stop following other things, definitely it will come back. So So it depending upon the patient. At the early stage, it is possible, but at later stage, it's difficult.
Yes, so when you are set in diabetes, it's not possible because it's a chronic lifestyle disease. So only we can manage it. We can't reverse it when it's at that stage. Right, Dr. Vinoth. Shivaji Dumale had a question that can diabetes eat seasonal fruits, and if so, in what quantity?
Yes, that is also a very important question. So, what are the fruits that you can eat? A person with diabetes can eat. See, for example, guava, amrut, and oranges, apple. These are the fruits which you can take liberally. There are certain fruits which have to be taken sparingly, such as, for example, grapes, pomegranate, and there are certain fruits which have to be completely avoided, such as mangoes and banana and chiku. All these have to be like completely avoided. If at all, if you want to consume, मतलब आपको मतलब craving हो रहा है ज़्यादा, you can take in a minimal quantity like half a banana or something like that, or one piece of mangoes, because during the season सब लोग आते हैं घर में, तो हमको मतलब देख के हमको मतलब और craving हो जाती है, तो that's actually practical difficulty. I can easily say नहीं खाना है, बंद करो, वो नहीं खाना, ये नहीं खाना, but actually it's very difficult. So it's difficult. If at all, if you don't have the ability to control your cravings, you can take it moderation. Moderation is the key.
बहुत दुखी हो जाएंगे सर सब सुन के कि आम के सीजन में आम नहीं खा सकते. But yes, right, absolutely. We should eat, but in moderate quantities. Now, Ahmed Faruqi also has a question to ask, that is, which type of medicine is best for diabetics?
Okay, this is a generic question. Like there are around like 7 or 8 classes of drugs, oral tablets, and 4 or 5 varieties of insulin. So I cannot directly say this drug is best. So depending upon the age, depending upon your kidney function, depending upon other factors, if you have associated hypertension, if you have obesity, like body weight, all these factors we have to keep in our mind before prescribing any drug to any patient. So that depends. That as I told you, like one size doesn't fit all. Like I cannot say like you can take metformin. So I have to look into other parameters of the patient before prescribing any drug to the patient.
Thank you, sir. And there is a question by Harvansh that how much should we rely on glucometer readings? क्योंकि सबके पास glucometer है. अब glucometer reading सही है कि नहीं है, but how much should we rely?
Yeah, it's also very technical question, and I definitely appreciate the participant for asking this question, because the glucometer measures the capillary blood glucose. So ideal is to get the venous blood glucose level, which is taken at the laboratory. So अगर रात में अगर आपको मतलब बहुत कम शुगर लेवल्स बहुत कम हो गया, जैसा hypoglycemia हो गया, that time we cannot go to lab. And also like we need to monitor the blood sugar levels frequently, like दिन में 3-4 बार मतलब you have to measure. It's very difficult to take a venous blood sample every now and then, like 3 times in a day. So that time this glucometer comes in handy. So it is reliable up to 90%, more than 90%. So it's like nowadays, like there are certain equipments have come in the market. So I think the Fable is also coming up with one of the continuous glucose monitoring equipment, like Libre Freestyle or something like that. So that measures without pricking the patient, and without pricking the patient, it measures that continuous. It measures some blood glucose continuously.
सब questions पूछ रहे हैं, तो एक मेरा भी question है sir. Diabetes does not run in my family, so I am safe from diabetes. Is it a myth or is it a fact?
Actually, diabetes runs in a family that everybody knows, but you cannot say that like मेरे family में कोई भी किसी को भी मतलब diabetes नहीं है, मतलब मैं जैसा भी मेरा मन की जैसा मैं मतलब जी सकती हूँ, ऐसा बिल्कुल नहीं होगा, मतलब ऐसा you cannot say. You have to follow the lifestyle behavior which we have discussed in our webinar. So even though your family members are not having any of your family, दूर के रिश्तेदार भी उनका भी मतलब नहीं है, फिर भी you have to follow this lifestyle habit, keep yourself fit, and to follow dietary habits and physical activity. That is very, very crucial.
Sure, sir. Thank you. And one of the participants have asked a question that diabetes management पर कोई program है क्या? and a lot of brands promise diabetes reversal on the internet. But कोई program है आप जानते हैं? So I don't know that would you be the right person to answer this question?
Yeah, actually the thing is that, like as I told you, like a reversal of diabetes, actually there are people who claim that they can reverse the diabetes. But as I said, like for pre-diabetes, those who are in early stage, it is possible that Phablecare itself doing like a wonderful job in that 360 care program. That those who are in pre-diabetic state, I have seen people not taking any drugs, only with the lifestyle management they are able to manage. So I think like you can enroll. I can suggest the participant to enroll in travel 360 care program, where you can have your diabetes status under control.
Sure, sir. Thank you so much. And yes, we have understood. I think all the viewers and all the participants, and especially me, I have really got a good insight about type 2 diabetes from the basic key. What are the symptoms? What are the signs? What are the complications? And how do you treat? And how does diet play an important role? And your ABCD that I'll always keep in mind. And thank you for being with us on the webinar, and thank you all the participants. If you have any questions, you can reach out to us on the email provided. And thank you, Dr. Vinoth, and thank you all. So I'm closing the session now.
Thank you so much.
Thank you.